Toronto's COVID-19 media briefing for Wednesday, October the 28th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer, Dr. Eileen Davila. Mayor Tory?
Well, Brad, thank you and good afternoon. Well, we're all feeling the effects of the pandemic in some way. We know there are neighborhoods in our city where some of our more vulnerable residents are being hit harder by this virus. Over the past few weeks, we've seen the number of positive COVID-19 cases drastically increase, especially in the northwest part of the city. Since the beginning of the pandemic, we've been working hard along with local councillors, especially the councillors in the northwest part of the city, to ensure that residents are aware of what they can do to help us slow the spread of the virus, and just as importantly, to make sure that those residents continue to have access to the information, to the services, and to the resources that they need during this particularly challenging time for them and for the area of the city in which they live. Today, Dr. Davila will be delivering an update on what public health is doing to help fight this virus in the Northwest. The government of the City of Toronto itself is also working to make sure that it is doing everything it can to help residents, of course, across the city, but especially in areas where we know there is increased spread of the virus, like in the northwest part of the city. For example, while the city doesn't administer COVID-19 testing or process the results, we are working to support community health centres conducting provincial testing where we can, and that means particularly in the Northwest. We have worked to make sure that we find ways to make city space available to community health centres and Ontario Health for COVID-19 pop-up testing sites in that Rexdale and Black Creek part of the city, or for that matter, any other place where a particular location can make a positive difference in terms of accessibility to testing. This week, pop-up testing sites have been requested by the Black Creek Community Health Centre and approved by Forestry and Recreation staff at Falstaff Community Centre, Oakdale Community Centre, Northwood Community Centre, Gord and Irene Risk Community Centre, and Chalk Farm Community Centre. So we've been trying to be responsive as quickly as we possibly can to the need for these places to do this testing on a more localized basis. We've also provided the Elm Bank Community Recreation Centre for pop-up testing by the Rexdale Community Health Centre last Sunday and this coming Sunday. This is based on careful consideration of how we can make testing as accessible as possible in places where it will make a positive difference. So these are examples of the cooperation underway to help people right now in that part of the city, working as between those responsible for testing and the city which has locations in which it can be carried out. Another successful cooperative effort was the work we did with the Government of Canada to open up a COVID-19 isolation site, the first of its kind in Canada, for people who can't safely self-isolate, because we know that has been an issue for families in the Northwest who in some cases reside in housing where close quarters make the concept of isolation very challenging, if not impossible. We're also partnering with many community-based agencies to implement programs and services in the Northwest and investing in these same agencies through the TO Supports Investment Fund. You may recall that last week we announced $1.9 million in funding through our TO Supports program to help several community-based agencies across the city, many of which actually operate in the northwest of the city. Through this TO Supports Investment Fund, the city has invested, for example, $283,000 to equip local agencies serving mainly Black Torontonians in Northwest Toronto to provide family support, mental health support, social connection, and community safety services. We further invested $820,000 in local food security programs in Northwest Toronto to support food banks, emergency food delivery, prepared meals, emergency food vouchers, and food handling certification. A priority for this funding was to ensure culturally appropriate food staples and meals are available to residents in their respective communities. The city continues to work with North York Harvest Food Bank, and of course, most of the northwest of the city, not all, is in North York, one of the TO support recipients as well, and that offers food bank service weekly from Toronto Public Library branches at Albion and Jane Shepherd. The city is now working with North York Harvest to expand food distribution throughout recreation facilities with a focus on neighbourhoods. The Northwest will continue to be an area of priority attention in the next round of funding from the TO Supports Investment Fund. Early in the pandemic, the city and the United Way of Greater Toronto created the Community Coordination Plan to make sure there was a coordinated response and constant communication between the city, the United Way, and all the different community organizations. The United Way was uniquely suited to perform this role as between the city and all these community organizations, since they work with both of us on an ongoing basis. That work helped to make sure that we got information to communities around masking protocols, physical distancing, virtual programs and services available to help people maintain physical distancing while still seeking the services that they need. We've also moved to make sure that we take other measures to help people to stay healthy, again across the city, but with a real focus on Northwest Toronto. And this has included the city providing additional funding and in-person mentor visits to childcare operators in the Northwest area of the city, as well as other COVID-19 hotspots, to support implementation of sound health and safety practices. Toronto Public Library Foundation continues to support the distribution of free laptops and Wi-Fi hotspots throughout the community agencies in the northwest part of Toronto, including Jane Finch Centre, Rexdale Community Health Centre, Unison Health and Community Services, Syme Woolner Neighbourhood and Family Centre, just to name a few. The city has revised childcare fee subsidy policies to help families affected by COVID-19 by doing the following: increasing the number of sick days a child can be absent from childcare, and ensuring that the 28-day modified Stage 2 rollback does not negatively impact families' entitlement to a fee subsidy. Toronto Community Housing, the Seniors Housing Unit, is responsible for 6 senior-designated buildings in wards 1, 7, and 5 in the north and west part of the city. During the pandemic, TCHC has been distributing face masks and information materials to all senior residents, conducting tenant wellness checks for the seniors, and supporting prepared meal delivery to all senior tenants in the Northwest buildings. So this is just an idea of some of what the city itself has been doing, aside from public health measures that Dr. Davila will talk about in just a moment. On the citywide front, I continue to work on the development of scenarios we can implement dependent upon existing circumstances at the conclusion of the current 28-day period of modified Stage 2. While ultimately the Day 29 Plus plan will be principally governed by public health considerations, considered carefully by Dr. Davila and her team, I am trying to ensure that the term is taken in its broadest context, the term public health, in its broadest context, obviously focused on COVID-19, but also taking into account broader conceptions of public health and overall individual well-being. I have made no secret of the fact that I am looking to see if we can develop, in a way that is safe and healthy, what I have come to call a doors open safely protocol or scenario that can help to guide us in the period of Day 29 plus. The objective here is to have a scenario available which is similar to how schools will reopen, seemingly safely and successfully based on experience to date, with a presumption they would be open, subject to rigorous health and safety conditions. While health advice will ultimately come from health experts, as has worked very well for us in battling this virus to date, I think it is fair and appropriate for me to ask that post Day 29, that advice include careful consideration, as I'm sure it would have, but now I'm sure it will, of at least one doors open safely scenario, which allows us to look at what ways exist, if any, to in fact have doors open safely and see them remain open. Dr. Davila will now update on current pandemic conditions across the city and on public health measures undertaken to assist our fellow residents living in the northwest of the city. Doctor?
Thank you, Mayor Tory, and good afternoon, everyone. Today, I am reporting 321 new COVID-19 cases. 140 people are now in hospital with COVID-19 and 37 are in ICU. It's widely understood that COVID-19 hits hardest in places that are low income or economically disadvantaged. And we know that racialized Toronto residents are especially vulnerable during this pandemic. Current data shows that 30% of people living in Toronto are classified as living below the low-income threshold, but they accounted for 50% of COVID-19 cases. Based on data, my team determined that over the course of the pandemic so far, Northwest Toronto stood out for higher rates of COVID-19, lower testing rates, and higher positivity rates in comparison to other parts of our city. One distinction worth making before we look at the specific numbers is that where a person lives is not a reliable indicator of where they got infected with COVID-19. The people of the northwest of the city are like everyone else, as likely to live in one part of Toronto, but travel throughout it. It's also important to recognize that a lot of hardworking people have to work outside of their home, delivering essential services that have to be done in person and on the job in places like hospitals, grocery stores, pharmacies, long-term care homes, and food production and distribution facilities. And they deserve our support as they go to work. The 3 wards that cover the northwest part of the city where rates are high are Humber River Black Creek, York Southweston, and Etobicoke North. Each of these wards is home to approximately 4% of our population. In contrast, Humber River Black Creek and Etobicoke North each accounted for 8.2% of all Toronto cases of COVID-19 in the last 3 weeks, while York Southweston accounted for 6.7% of our total cases. Another measure of the burden these areas experience is the case rate per 100,000 people. While the overall Toronto case rate has been 172.7 cases per 100,000 people in the last 3 weeks, these 3 wards experienced COVID-19 rates that were between 70% to 120% higher than for Toronto. Specifically, in Humber River Black Creek, it was 387.8 per 100,000. In Etobicoke North, 356.7 per 100,000. In York Southweston, 293.1 per 100,000. To sum it up, 3 adjacent wards in one part of the city, representing roughly 16% of the total population, or 23.1%, almost 1/4 of all Toronto COVID-19 cases over the past 3 weeks. Much recent attention has been given to the added value of looking at percent positivity. This information is reported to us at the neighborhood level, but I can tell you that these 3 wards contain neighborhoods with some of Toronto's highest percent positivity values. Only 4 of the 26 neighborhoods included in these wards had percent positivity values that were less than 4%. This is not a new story, just the latest chapter in a troubling one. Through the pandemic, there has been focus on the heavy burden borne by these areas and specific activities to address the imbalance. These activities are delivered by Toronto Public Health and by our partners in other city divisions and at senior levels of government. As you just heard, Mayor Tory described the efforts by our city partners. I will speak to many of the efforts led by my team at Toronto Public Health. Our work in Northwest Toronto and in any part of Toronto where the pandemic has or may yet hit hard breaks into 3 categories: providing information, direct interaction, as well as access to health services and health services promotion. Our most important way to reach people with vital information about COVID-19 transmission, prevention, testing, and social supports is through our COVID-19 Outreach Rapid Response Team. You will hear me refer to them frequently throughout my remarks today. Access to health services and promotion of health services helps people access testing. It also means advocating on their behalf to expand access to testing. My team works closely with Ontario Health's Toronto region to provide recommendations for testing needs and testing sites. My team also shares COVID-19 data like neighborhood case counts to work with community partners to identify appropriate sites for testing, which is funded by Ontario Health and planned and delivered at the local level by a variety of local agencies. We have used data to recommend the most strategic test sites in neighborhoods. The data helps us understand which neighborhoods have low testing rates, yet continue to have high rates of COVID-19 infections. These are areas that would benefit most from increased access to testing. Practically speaking, the results have led to testing in locations at community recreation centers, to malls, and even a church. It allows for testing where people are living their daily lives. Toronto Public Health's COVID-19 Outreach Rapid Response Team promotes community pop-up testing sites and collaborates with community agencies to help develop translated promotional posters and social media banners. In the 2 most recent months, we have helped raise awareness of testing access by promoting 17 pop-up testing availabilities. The team has also distributed test site information in the community through means like community canvassing, as well as distributing posters in various locations, such as apartment buildings, places of worship, and grocery stores. The Board of Health and Council have called on the province to increase the availability and accessibility of provincial testing in the Northwest. Providing information is the second area of focus. People cannot protect themselves properly without knowing what to do. The outreach team delivers presentations about COVID-19 to groups of residents, primarily those living in Toronto neighborhoods with the highest COVID-19 case counts. They address questions about transmission, prevention, testing information, and provide community support. The outreach team also present to community agency staff and volunteers to build their capacity in communicating COVID-19 public health messages to their clients. Presentations have been made at drop-ins, at senior services, cultural services, and community centers. Between mid-August and mid-October, the outreach team made almost 140 presentations, reaching 2,900 residents and almost 550 staff at community agencies. Direct interaction is also very important. 2 ways we interact with people in the Northwest and elsewhere are through canvassing and through information tables. Over the summer months, outreach teams conducted almost 80 community canvassing efforts at locations like shopping centers, grocery stores, and places of worship. They also set up information tables in various community locations, such as food banks, drop-in centers, and multi-unit residential building lobbies. Between mid-August and mid-October, this outreach allowed us to connect directly with more than 2,100 people. Between mid-August and mid-October, we also provided nearly 60 information table setups and were able to reach more than 2,300 residents. In a large, diverse city like Toronto, you can't operate on the assumption that everybody speaks the same language or speaks English fluently. This is why our community outreach team is multilingual and provides services in 28 different languages. Currently, information relating to COVID-19 is also being translated into approximately 30 languages. Wherever you live, the steps for self-protection are the biggest and best things we can do to limit the spread of COVID-19 in Toronto. This means keeping at least 6 feet apart from others as often as we can, wearing your mask whenever you can, washing your hands frequently, and trying as much as possible to limit your contact with the people that you live with. While we are all in this together, our experiences living with COVID-19 can be quite different. Those differences illustrate health inequity. Simply put, when the health of some people is different from others because the circumstances in which they live are so different, often so unequal, that one unfairly suffers where another succeeds. This is why our Board of Health and City Council called for the creation of a COVID-19 response equity action plan by the city and as well by the provincial and federal governments to eliminate the unequal impact of the pandemic experienced by many communities. The Toronto plan will be presented to our Board of Health in December, a plan to identify tailored, targeted action to facilitate good health in the whole city and to address the inequities that are felt heavily in neighborhoods such as those we've spoken about today. This work will need a united and concerted effort by all levels of government to support the conditions where all people are able to rise to their full potential. COVID-19 will not be with us forever, but the factors that worsen it in some parts of Toronto will not go away with it, not without hard work and a clear plan. The health of a city is determined by the health of the whole city. I feel confident we have seen in the pandemic a new understanding of what can be achieved when we work together. If COVID-19 has a legacy, I hope it will be a commitment to acting in ways that reflect the many things we've learned about ourselves through this, and a resolve to act in ways that reflect that knowledge. With that, I'll turn it back over to Brad. Happy to take any questions.
Thank you, Dr. DeVello. We do have a number of staff on the line to answer these specific questions, including Chief Pegg. Our first question is to Megan King from Global News. Go ahead, Megan.
Hi there. This is a question for Mr. Mayor.
Yes.
Hi there, Mr. Mayor. Canada's largest fitness company, Good Life, has asked its members to reach out to their MPPs to help get their gyms reopened. In Toronto, they are closed for 28 days. Do you think it's safe for gyms to reopen given the rise in COVID numbers?
Let me put it this way, and it fits very much into what I was talking about in terms of a doors open safely kind of approach. I think there can be a way found where in certain circumstances, subject to certain conditions, we could have gyms reopened. You'll recall that the advice we received and that we passed on to the provincial government back a little while ago was that it was group activities in particular that perhaps formed more of a danger to public health. But I'm not presuming upon that still being the case today or anything else. I'm not a medical expert, but I think that one of the reasons I've asked for doors open safely scenarios to be brought forward is so that we can find a way in which we can have people have access to what are healthy activities to the greatest extent possible, but still safe in the context of public health. And I think there can be a way found to do that.
Thank you. And on to patio season. While City Council has approved an extension for patio season to support local restaurants, curbside patios will still have to close due to snow removal necessity. How are these businesses being told about this? And do you think they have enough warning to decide whether to stay open or not? There seems to be some bars that weren't aware that they wouldn't be able to operate.
Well, going from memory, I think I first started talking about the absolute necessity because of snow clearing, nothing more and nothing less, but it's very important that I started talking about this probably 2 weeks or more ago, very publicly, repeatedly. I think that around that same time, there were notices that were given of the fact that we would begin the process, because it didn't all happen on one day, of removing the things that protected this space in the curb lanes for use as patios. And so I'm sorry if people haven't received that news and were caught a bit by surprise, but I think it was obvious, fairly self-evident that we would have to clear away these spaces for the winter months because of the snow. and that it is my fond hope, and I'm really looking forward to receiving a report from the staff that will allow us as soon as possible to say to those very same businesses and to the people who enjoyed those patios, they will be back as soon as we can get the snow cleared away and spring comes in let's say, April. So that's the objective.
Okay, thank you. We'll go next to John Chidley Hill from the Canadian Press. John, go ahead, please.
Mr. Mayor, this question's also for you before you put that mask on. You just spoke about trying to come up with a plan for reopening gyms. I'm curious, why is it important to reopen gyms?
Well, I think it's important to reopen as much as we can, because I think that if you look at this broader context of public health, which I've learned about from Dr. Davila, among others, which says that it isn't just about people not having COVID, which is extremely important, obviously, but also it's about their state of other physical well-being, it's about their mental health, it's about their financial state of health. This is all part of what causes people to be overall healthy in our city. And part of that is the opportunity to go to a place where you can get exercise. And increasingly, as the weather gets colder, people will be looking to do that in settings that may be indoors. So the challenge for us is to have the doors open safely so that people can go to gyms or many other places, including restaurants, but do it safely with the maximum number of rules and regulations in place that promote safety while still making it viable for places to be open. But physical exercise and the ability to go places like that, even just the socialization that it involves for people who've been cooped up, are all important, but you have to do it safely. And so that's what we're working to try and find that way right now.
Thanks, Mr. Mayor. I don't have any follow-ups.
Okay, John, thank you so much. We'll go next now to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. I was just wondering if you could first just clarify these pop-up locations that the mayor was talking about earlier. Are these areas which the province have approved pop-up testing will proceed this weekend? And I'm wondering, just to Dr. Davila, obviously the Northwest is one area where you're looking for more information through testing, but I'm wondering if you could tell us what other areas you have requested the province step in to allow more pop-up testing or even more access to testing so that Toronto Public Health can get a clearer picture of exactly what's going on there.
So Matt, to the first point you raised in your question, so testing and access to testing is really something that is under the provincial jurisdiction. They oversee all of healthcare, and testing is indeed part of healthcare. It is something that we have to liaise with, and of course our data help to inform where there are areas of COVID-19 activity. And as well, we have data now that we are publishing and sharing with relevant partners, including our provincial partners, around where testing rates seem to be falling behind and therefore would be areas where more testing might be warranted. So we're providing that forward, and the ministry and its healthcare agencies and partners who actually engage in that kind of work in direct frontline on the ground healthcare are working with Ontario Health and other provincial agencies to make pop-up testing and other forms of testing available, premised at least in part on the data that we provide. So as we get data and understand which areas of the city would benefit from increased testing, that's the kind of thing through our liaison functions, both with the province and with community agencies. We put information out there and suggest, look, what we're seeing in our data is that there are certain neighborhoods throughout, various parts of the city. Based on testing rates, they look like they could use some more testing. Who is around in the area? Who has connections into that community? Who knows where the testing might actually be most valuable, meaningful, and resonant? And how do we connect with people, residents within that community, so that when we set up testing efforts, they're likely to be successful? That's the kind of work that we do, and it's the kind of partnership that's necessary to solve the challenges of COVID-19.
Okay, and I'm just wondering, at council this morning, there were a number of questions directed at you about areas where you can identify where transmission is occurring, because you've of course said repeatedly that just where somebody lives doesn't mean they've caught it there. But I'm just wondering, are you able to actually identify those zones and put that data out there? And it seemed like the suggestion was that there could be maybe some areas where there is low transmission rates where they could perhaps see fewer restrictions. Is that possible? Because I know New York has cluster zones and buffer zones. Is that something you could do on a smaller scale in a city like Toronto?
Well, I think there are a number of different options that we're all constantly trying to explore. The New York model is certainly one of them. We've seen, areas that are providing for hot zones and buffer zones around them. And we've seen other jurisdictions just go to, straight out lockdown. As you can see, this is something, and it's a circumstance where we're all learning very much in real time, simply because this is a new virus. What I can say is that when we do look at transmission here in the city of Toronto, we do know, and we have reported out where there have been clusters. And notably, when we talk about transmission, that's exactly what we're talking about when we talk about outbreaks. And on our website, we actually have a specific component of our website dedicated towards outbreaks. And as per direction from the Board of Health, we are actively working on upgrading and constantly improving that section of our website that describes outbreaks, so people might actually have a better sense as to where transmission is happening in our city so that they can take appropriate action.
We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, this question is for both Mayor Tory and Dr. Davila. You've been urging people to follow all the rules, and in some cases, when there's specific examples of people breaking the rules, have sort of called them out from large parties and so on. I'm wondering how you both react to a photo of a member of the provincial government standing, smiling with 40 other people, not a mask in sight. Sam Oosterhoff has said he apologized for momentarily taking off his mask, but as I said, there's no masks there. And in fact, the owner of the restaurant where it happened says he repeatedly asked the MPP and the other guests to put on masks, and they did not. How do you tell people to follow the rules when there's that example out there?
So, I have to be upfront. I have not seen the picture myself. I have heard about this, and obviously, I recognize that this is challenging for all of us. I think we've heard a number of people comment on the experience of pandemic fatigue. And, I think if we're all being very honest with ourselves, I think we're all suffering from a degree of pandemic fatigue. It has been a very long, several months now, of fighting COVID-19. So I suppose within the realm of public health, we feel a special brand of pandemic fatigue, but we too are members of the community and suffering many of the same challenges that all of us are living through, having to restrict our activities and adapt and adopt new practices that frankly are not natural to us. So I think, as with everything, I think we're constantly seeking to resolve to do better with each and every day. And I would hope that the same is true of our leaders. And I'll turn it over to Mayor Tory if he has further comments.
Well, I have seen the picture many times, and I can only describe it as unfortunate. But, what was as stunning to me, I myself, one time went to a park and pulled a mask down that I was wearing and was rightly criticized for that, and I apologize for that. I have had my picture taken many times in the period since then over the last few months by people where I was and they were wearing a mask, but nonetheless they got too close to me, and I've had to go to great efforts to make sure people didn't get too close, certainly not without a mask, or people want to touch you, and it's just part of what normally would be going on. What was more surprising to me, again, it's unfortunate that an elected leader, a person with a public profile was not wearing a mask, was that the person was surrounded by 40 other people who also weren't wearing masks. A big crowd of people standing very close together, not wearing masks, any of them. And that is something we've been talking about every day, saying, if you are going to be in a circumstance where you can't keep physical distance, wear a mask. And I'm not sure there still wouldn't have been some public discourse about this if all the people had been wearing masks standing in such close quarters. But to have the two things happen was very unfortunate, because it just undermines, the message that we're trying to get out there about the importance of wearing a mask. I'm one of those who believes that people should wear masks as often as they can, for as long as they can, in as many places as they possibly can, because I think it will actually make a real difference. But it didn't clearly happen there, and that's unfortunate.
Thank you. I have no further question.
Okay, Dave, thank you. We'll go then to your colleague Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. My question is for either Mayor Tory or Dr. Davila. Are you starting to see that restrictions are resulting in worse all-round health outcomes than not having restrictions? Is that why we're starting to hear some language about, you know, preparing a reopening plan for day 29?
So I'll start off, Francine. You know, what we have noticed and what I have been impressed with throughout the entire pandemic is, you know, the commitment of Torontonians. I really have been impressed, despite being very, very tired. And I know that there have certainly been health impacts across the board. You've heard that which we've spoken about in the northwest of the city, but it's not exclusive to the northwest. I think that what you have heard from us throughout the entire pandemic has been the objectives that have not been exclusively in one direction or another. The objectives throughout the entire response to the COVID-19 pandemic have been to mitigate the impacts to the greatest extent possible of COVID-19 directly on the health of the people of Toronto, to preserve the capacity of healthcare to respond to the many needs that our city has and its population has, and of course to mitigate those broader health, social, and economic impacts. I think we have worked very hard, not only here at Toronto Public Health and in concert with other city divisions and other government partners, but as well with our communities to try to achieve that balance as best as possible. And I think what I can say is that you will continuously hear us and see us striving to achieve those objectives in as balanced a fashion as is possible. And I'll turn it over to the Mayor.
Well, my main point in bringing forward this concept of a plan for day 29 and going forward, and the concept of doors open safely, is really just to start from the premise that you have to have a plan when you end this 28-day period. You can't just come out of that and say, well, we're back to whatever business as usual was. I will admit that I have a bias to a plan that can have doors open safely in as many places as possible, simply because I've learned from Dr. Davila and others about this broader concept of public health that says that if people are out of work, they can't feed their family or themselves properly. They may not be able to pay their rent and might lose their housing. They're going to have mental health issues by virtue of the fact they're in crisis because of a lack of work or whatever in their family. So this is a broader context within you look at public health. And secondly, I think that people out there in the city of Toronto want to see that we have a plan because they have the right to expect that from us as a matter of maintaining public confidence in us. I think they have been confident, and as Dr. Davila said, they've responded extraordinarily well in terms of, for all the talk about non-compliance with masks on the TTC or those kinds of things, people have been extraordinary in their compliance and their cooperation and their understanding. But I think they also would expect we would have a plan that isn't just static and stays the same all the time in a circumstance that's rapidly changing, and that we would have a plan that takes into account this broader requirement of public health so that we can, you know, try to move ourselves back towards a more normal existence, but in a way that is safe and healthy for everybody. So that's exactly what has been behind my comments, and I've shared those comments with the Premier and with lots of other people that I've been talking to try to get their views, but also to say that I think this is something we just have to be doing as a matter of the responsibility we have as public officials.
And my next question is for Mayor Tory. How would you describe the impact that COVID-19 has had on independent businesses in Toronto?
Devastating because you know, you went in independent businesses that have been around for some period of time are used to recessions where you lose a percentage of your sales and where some of your activity is curtailed because of economic slowdown. What nobody's ever experienced before in our lifetime, I don't think, is a complete cessation of business, which they went through for a period of time in some cases. In other cases, they've had several of those complete cessations of business because of public health measures. And so I think this has caused you know, liquidity crises. They've told me that because I've spent extensive periods of time talking to and listening to businesses. It has caused, you know, for many layoffs to have taken place, even where those businesses did survive, but with far fewer people. It has caused businesses to be lost. So it's caused untold anguish and damage to the economy. And what you have to hope, you know, just like grass that sometimes will die is that there's a way in which it can come back if you water it and care for it, and if we get some break on the health side and maybe some, kinds of new approaches that we're talking about now for the next stage of all this. But it's been devastating, and I'm confident that Toronto has such inherent strengths. We are seen so well in the rest of the world. We are such a linchpin to the success of this country that we can come back, and some of those businesses will come back, but some won't. But it's been devastating. I don't think there's any other word that you could possibly use to describe it. Even that might understate the impact that it's had.
Okay, thank you. We go next to Richard Warnicker from the National Post. Richard, go ahead.
Hi, this question for Dr. Davila. Dr. Davila, have you seen any evidence or any suggestion that people who really do need COVID tests, so people who are symptomatic or who are close contacts of a known case, are avoiding getting tested in any kind of numbers?
So what I have certainly heard from community partners in particular, who are a little closer to members in our community and residents in the community by virtue of where they're situated, have spoken about challenges and some reluctance on the part of members of the community to get testing. So I certainly heard that, but not directly. It's been through other partners.
And what kind of reasons, I guess, are then you hearing secondhand for that reluctance?
Well, I think there are a number of reasons. For some people, the harsh reality is that if they are diagnosed with COVID-19, there is concern around what that means for work, given that there are isolation issues, and what that will mean for family livelihood. If you're the sole breadwinner and you are unable to work and your circumstances are such that if you're not working, you're not taking in income, your entire family livelihood is seriously in jeopardy. So that's one example of the kinds of an issue that might actually get in the way of people taking advantage of testing, even in circumstances where that testing is warranted.
Thank you.
We'll go next to Jane Stevenson from
Oh, hi, this is for Mayor Tory. Just getting back again to Jim question. Part of their arguments from gym owners is that the dance studios were allowed to reopen and that they should be treated the same. Do you agree that dance studios and gyms should be treated the same in terms of whether they should be closed or open?
I won't just sounds like it makes sense. Distinguishing feature with the dance studios, I believe, when they were considering reopening them, which they ultimately agreed to do, the province that is, was that dance programs have a defined enrollment. So you knew exactly who was going to come, how many people were there, and so on. Is it possible that you could have gyms operated in a way, as I think was the case previously, where you had a certain restricted number of people in the gym at a given time? Is it possible you could do it without the group activities, which is something Toronto Public Health had recommended in previous times, so you don't have that kind of uncertainty in group activity? Yes. Should they be treated as being exactly the same? I don't think they are. But I think that what's needed here is what I'm sure is happening, which is a careful examination. We now have about 10 days left in the 28-day period, a careful examination of gyms, their utility to people's good health, as was asked about earlier, and to socialization, but also at the same time the risks that they do pose as places of congregate gathering. And I'm sure that we can come out with something that could see them open safely, but that's what we're working on across the board in all these different kinds of businesses, to see if there's a coming together of the desirability of having them open, the desirability obviously from a business perspective of having them open, and good health and safety for people, which is something that we've obviously been deeply concerned about always, but especially in the last 6 or 7 months.
follow-up, Jane?
No follow-up. Thanks very much.
Okay, thank you. We'll go next to Lucas Meyer from News Talk 10. Lucas?
Thank you very much. Mayor Tory or Dr. Davila, really, just to get back on doors open in the gyms, all this talk about, having a plan ready, I'm curious if Toronto Public Health has specific recommendations as well around this. For example, on day 29, when they open back up, certain classes maybe being closed for a certain period of time or something like that. Are there specific recommendations that the city is making to the province, and if so, what are some of those?
So Lucas, I think that's an excellent question. And if I can paraphrase what the mayor was saying earlier, really it's beholden on us as professionals to start planning in advance, right? The best thing to do in terms of readiness and what's most responsible, I would say certainly for us as public health practitioners, but for the entire city as, you know, an important level of government and one that seeks to best serve its residents. It is important to plan in advance rather than waiting until the last minute or waiting until day 29 itself to, you know, come up with a suggested plan or course of action. So I can tell you that we are absolutely having active conversations, and we have had them, you know, over the course of the last 2 weeks, and I expect that conversations are going to continue over the next several days around what makes the most sense from our perspective as public health professionals. Clearly, we're not the only partner involved in this. Certainly, our provincial counterparts will have to play an important role in that discussion. We are absolutely, you know, in conversation with them. We're in regular conversation with a variety of provincial counterparts. And of course, we're always interested in hearing that which our stakeholders and our community has to say. So it is an active discussion, and I would just ask you, Lucas, to stay tuned.
I will. Mayor Tory, then. Yes, please. Yes.
The foundation piece for all of this is good health. Obviously, I mean, we're not going to spend all the time and effort and all the sacrifice people have made to fight this virus and then not use that as the foundation piece for a doors open safely or any other kind of policy. But I think what I felt, and I mentioned this probably 10 days ago,